The infection prevention and control agenda is absolutely crucial to our focus on patient safety and patient experience. I think the key advantage of being a member of the IPS is the ability to be able to network and connect with each other. That's one of the most radical things that people can do, is connect with each other, because by connection we improve and we save lives.
The IPS informs and influences the role of infection prevention by bringing people together and allowing us to have the network to interact with our peers on different sites, which increases our knowledge.
Where healthcare often doesn't communicate terribly well with each other, infection preventionists often do.
Yeah.
Whether they're community-based, acute-based, in different countries, towns, you will contact your fellow number if you've got a patient transferring. I've had patients recently from London. You contact your opposite number to find out more about them.
Yeah.
So it becomes a national, international, if necessary.
Well, it's a network of professionals.
It's never dull. You never know what you're going to come into, you never know what questions people are going to ask of you, and it takes you into all sorts of different settings and gives you different challenges. I've never been bored in infection prevention.
The key skills of a great IPCN is having the ability to listen, having the ability to be a good communicator, and having a good sense of humour.
Everything's interesting in working in infection prevention. You are allowed to be very inquisitive, look into places that nobody normally would look into, and that helps drive patient quality and safe care.
I think being part of the IPS gives you an opportunity to influence guidelines and policy direction, regardless of whatever country you're in.
Or speciality.
Or speciality, yeah. You're right. Because I know that we've talked about government targets in Scotland. I know that we've influenced
antimicrobial resistance
and C. diff policies all over.
Yeah, it's an excellent way for networking and sharing those ideas as well across the countries, because even though we are from different nations, healthcare is the same. Patients are at the centre of our care.
Yeah, and we can waste an awful lot of time developing something ourselves when really we could just steal it from somebody else and really make a difference a lot quicker.
It's about getting the best of the best, isn't it?
Indeed.
And in Ireland we get a chance to work with the HPSE and HICWA to develop the national standards. So we're there at the front line advising strategically on where we're actually going to go with infection prevention and control nationally. Well, none of us want to be perceived as the policeman. We're there to support the staff. We're not there to actually, tell them constantly and to be knocking them. That actually we're there to provide them with the information that they can actually do the best they can, and that we're actually patient-centred. Well, our caseloads are very diverse. It's very much a cradle to a grave service.
It is.
With huge diversity of needs and also services that are required. And I think it's very important that it is tailor-made to the specific client's needs, because one size does not fit all, and that's where the infection preventionists come in. We can give that advice to tailor to suit the patient, and we're very patient-focused.
Well, the main challenge that we are aware of at the moment is the increasing amount of antimicrobial resistance. There are new superbugs coming through, and that poses particular problems with patient placement, but also in ensuring that the staff are fully aware of the risks that are involved. We also are facing an ageing population and the additional financial constraints that is putting upon us.
Well, as infection prevention nurses, if we are providing the right advice and support to frontline staff, then we can support them to do the right thing every time and that's got to protect patients.
The major focus about one infection being too many, being an insult to our patients, and the overall vision of having no harm, avoidable harm, come to patients was for me one of the strongest messages that we could have across the country.
The role in infection prevention varies according to your place of work. Fundamentally, it's about balancing risks to ensure good quality and safe care for our patients.
One of the main roles, I think, for an infection preventionist is that we always remember our patient, that we're the patient's advocate. So many of our patients are frightened maybe to inform staff when they haven't done the correct practice. I've had personal experience with a family member, and it really brought it home to me how important it is that we advocate for our patient, the staff have the correct advice on how to perform their practices, that it's evidence-based, but also then that our patients are empowered to highlight to staff that actually maybe they could do things a little bit better.
If somebody wanted to work in infection prevention, I would say if you really want to make a difference, then just do it. If you've got a commitment to education, if you enjoy new challenges, then this is a great job. It's never dull.
One of our major roles is to actually provide our patients with an equitable and a quality service. Nobody should be denied care because of their infection control status.
Essentially, infection prevention is about three key things. It's about ensuring a safe environment for our patients, ensuring an educated workforce, and finally, and most importantly, ensuring international best practice so that no patient is harmed by a preventable infection.